Welcome to Adapt NCLEX. Two similar NCLEX answers, opposite answers. Here is how to always choose the priority one, fast and easy. NCLEX prioritization, how to choose the right answer. I'm going to walk you through steps in choosing right answers, even when you're stuck or you don't know anything in a very short time. First of all, let's look at this question. And I want you to put down your answer and let me know which answer choice you select. A nurse is caring for a client who reports sudden shortness of breath and mild chest tightness. Which action should the nurse take first? Auscultate the lung sound, assess respiratory rate and oxygen saturation, place the client in high follow position, notify the healthcare provider. If you find yourself in this situation, this is the first question on the NCLEX and you saw that. Which answer choice will you choose? You listen to the patient lung, you assess the respiratory rate, oxygen saturation, place the client in the follow position, notify the healthcare provider. The key word is what? Patient has a sudden shortness of breath and chest tightness. There's a change in patient condition, asking you to do something first. Is this patient crashing? Or you have time to choose something? I call it BESHARP. But the strategy this video is all about is how to select answers. I'm going to show you how to answer these questions, test-taking strategy. Whatever answer choice you pick, I want you to put it down in the comment. But this is the clue. Answer 1 and 2 are saying the same thing. They are all assessment. If you have two assessment, then they are both wrong. Therefore, we have two similar answers. Auscultate the lung, you're making an assessment. Assessing respiratory rate and oxygenation saturation, you are making an assessment. You can't do two assessments in a question. That means both has to be wrong. They are similar answers. The NCLEX does not tell you. This is the strategy we'll be going through to choose answers which are similar and eliminate them, which one is opposite, which one you're unsure, and which one you just have to use rescue thinking, which is the new form of NCLEX questions. They'll be asking rescue thinking in prioritization and a form of prioritization. As you can see, you got to intervene. The nurse can do something before the provider. Therefore, high follow position is the right answer. 1 and 2 is the wrong answer. 4, we will do whatever we can do before we let the provider know. This is the first question. Now let's go through the strategy, and we have several questions to illustrate each one of them. So stick with me, stay with me. Let me show you how to go through the steps, and you will never forget how to answer questions anymore. The first thing is, this is my prioritization. I call it BESHARP. Why? You got to have something to focus on and say, this is what I'm worried about when I'm doing prioritization. It doesn't mean all of them are right. It means you're focusing on them. Then you come back and you attack them one by one. I'm worrying about breathing because these are bad problems. Any patient that has a breathing issue is a problem. Which one would you know? They're not going to tell you. One of them is a buzzword. That's what I use in my videos. I call them buzzword. Client with the pain-filled sputum has pulmonary edema. If you have pulmonary edema, you have a breathing issue. This has to be a priority, but you got to go through all the answer choice they've given you and select if the B is the priority. This is not in order. It doesn't mean you got to do ABC. I just go down by the way the acronym. So you do for the B, you check if patient has electrolyte problem. Example is what? Client with the peak T wave on the EKG. This is the patient has hyperkalemia. It's a bad problem, right? You check if the patient has sepsis. Client with diffuse abdominal pain and temperature of 101.5. That's sepsis. Patient has peritonitis. They will not going to tell you that patient has peritonitis, but the signs and symptoms is what you pay attention to. And then shock. Somebody have traumatic amputation, cut the leg, and then what? Cold extremities and a heart rate of 120 is shock. but they're not going to tell you it's shock. Therefore, this patient probably is bleeding. You got to pay attention. Patient who has diabetes and diaphoretic, automatically that patient is hypoglycemia. You got to do something. Patient who has thyroidectomy and a stridor has a airway problem. Those are buzzwords. And the patient who just had a seizure and is lethargic is a neurological problem. It's a priority. Patient who has a high riding testicles has pain that will make them lose their life. Not every pain will let you lose your life. If you need details on the BESHARP, check out Dr. NCLEX. I have a bunch of video. I explained in detail how to do and how to use them. But this video is basically telling you strategy. This is just giving you the things that you know you can use at the back of your mind. So this is what the BESHARP means, but how do you apply it when you're answering questions? It depends on the situation. So that's the BESHARP. These are the things in it. Now, this was the question that was asked. I'm making this video because the subscriber want me to go through some of the steps and eliminating answers, finding the answers, which one are similar, which are the same. Now, decision tree at the back of your mind. You know your BESHARP, but that's not the end of the world. You got to think also. That's why I said be sharp, not expected. When you're being sharp, you're taking care of all the things I said. Then you ask yourself, is the patient dying right now based on what you see? Whoever is in the BESHARP who is dying is the one you pick. Is this an unexpected finding? I don't expect it, then I got to pick it. Can I do something right now? Like the first question we saw, patient is not doing well. I'm not going to call the provider. I can do what? Provide a high Fowler position, and that will improve patient oxygenation, and I can let the doctor know. Can I do assessment or action? You saw two assessments. One said listen to the lung, right? One said check for the respiratory rate and oxygen saturation, and they both the same. And another one is action intervention. And are we dealing with safety or comfort issues? Sometimes you have to provide some teaching. All of them, safety, trump, comfort, and teaching. Pay attention. When he says, if you are stuck, remember, safety is better than comfort or teaching. Now, when answers look similar, this is the key. This is opposite. How do you know? This is the key. I want you to stop the video and think about this carefully. When the two answers are similar, both are wrong, like we saw in the first example. Administer oxygen. What does that mean? Apply nasal cannula at 2 liters per minute. They are the same. You give them oxygen. Both of them, you are giving them oxygen, but it's being described in a different way. Don't let the English trap you. Opposite answers. Number 2, keywords. One is correct. If you see two opposite answers, don't leave them alone. Stick with them. One of them may be right. What is that? Encourage oral fluid. Pay attention. Keep client MPO. Oh, one said feed the patient. The other one said don't feed the patient. That means these two, one of them is the right answer. Then you have to look at the scenario, which one is safe, and pick one that is safe. Encourage ambulation. They said walk. This one said don't walk. Therefore, you have to know something should be ringing in your ear telling you one of these may be right, but which one is right is based on the scenario. Next one. When answers look similar, now I'm giving you an example. Which action should the nurse take first? A nurse is caring for a client with suspected hypoglycemia. I've told you patient has suspected hypoglycemia. That means I've done something. That is your clue. I want you to pay attention to this. This is the test-taking strategy. Suspected. The word suspected. How do they know patient has hypoglycemia? That means they have done something. Number one said, they said, which one do you do first? Patient is not dying. When you see first, they are not dying. That means priority, but you got to pick one. You got to be sharp, right? You said, hey, I got to save the patient from dying. That's risk reduction. That's why prioritization is difficult. I'm preventing risks, right? What is the key? Check the client blood glucose. This is what they're telling you. A patient who has suspected hypoglycemia, they said I should check their blood glucose. Assess for the diaphoresis and tremor for somebody who has hypoglycemia. This one said, give the patient orange juice. Which one do you think? Decide. The last one said, document the finding. You can say this is not, you're not doing anything. So because it's a prioritization, you got to do something. Number 4 is wrong. Now, if you look at 1 and 2, they're saying the same thing. Checking glucose and checking for signs of hypoglycemia are the same. You're making an assessment. Check the client blood glucose is an assessment. Assessing for diaphoresis is an assessment. At the same time, they know the patient is what? Hypoglycemia. They have done an assessment. Why would you do any more assessment? 2 answers are the same. Therefore, you know 1 and 2 are wrong. You cannot pick it. This is how NCLEX will trap you. These and this are the same. So when you see 2 similar answers, eliminate it. This is your right answer. Number 3, we got to give the patient orange juice. Now, when they are different, one of them has to be right. But based on the scenario, you got to pick the one that is appropriate. Which action should the nurse take? A nurse is caring for a client with decreased level of consciousness. That means the GCS is low. You got to break down the question. You got to spend time, figure out what the question is asking. If you don't spend time trying to figure out what the question is asking, you will not be able to answer it. And that's where you go for the buzzword. And the first buzzword is what? Decreased level of consciousness. Write it on your own. And which action I should take. That means I have patient with low GCS. And I got to protect my airway. That's number 1. Every time GCS is low, protect the client airway. One said, encourage oral fluid. Another one said, keep NPO. The other one said, elevate the head of the bed. And then one said, rearrange the client frequently. The question say, decreased level of consciousness. I got to protect the airway. And I look at the answer choice. One said, feed the patient, and another one said, keep them NPO. These tell you that even though this sound like very nice, elevate the head, it's not going to fix the level of consciousness. You want to protect the airway. How do you protect the airway? 2 answers are saying something different. One said feed, the other one said don't feed. This is your clue. This is your signal telling you one of them has to be right. Therefore, you have eliminated 3 and 4. Then you look at it. If I got to protect my airway, of course, you got to bring your content. You can't just answer it, but we'll find some way. I'll show you how to answer it without knowing the content. But this one, you know, I got to protect your airway. If you know the content, it's a little bit easy. The answer pop out like a candy. In this one, what do you think? If I'm going to protect your airway, you're not drinking. I keep you NPO. Number 2 is the right answer. In the same situation, you got to ask yourself, do you assess or take action? Every time assess, unless you think the patient is crashing, and they will tell you in the question that somebody is crashing. Therefore, I need to do what? Do intervention rather than assessment. What should the nurse do first? I don't know. Do I assess, intervene, or do anything? A nurse is caring for a client who suddenly report chest pain and shortness of breath, acute change in condition. This patient is dying. All of a sudden, unexpected finding happened. The chest, that's your heart, and your lung is in trouble. Both of them are in trouble. That means I got to act fast. Give the patient nitro, check the patient vitals, place the patient on oxygen, and call the provider. Do you assess or do you intervene? The patient's already told you he's not doing well. Based on what I've told you, you can see he's dying. If you dying, I don't need any more assessment. I got to do intervention. Giving them nitro is not going to fix both. Vitals, I'm doing an assessment. If I place you on the oxygen, it's better. You're getting oxygen for your lung and your heart. And I let the doctor know. I intervene while calling the doctor where I can give you oxygen. I can give you oxygen, then call the doctor later. It's much better. So number 3 is the right answer. I'm using these straightforward questions so that you can use it. It does not matter how they trick you. The language is the same. The way to analyze the question is the same. So don't worry that any question they give you, go through the mental process and you'll be able to figure out. So for this one, number 3, better. And if you're unsure, when you don't know which answer to pick, I want you to slow down. Stop everything you're doing. Don't panic. Don't waste your brain cells on anything and screw it up and pick a wrong answer. Ask yourself, which answer choice will keep the patient alive? You got to go through the mental process. Don't rush. Hey, you're already unsure. Therefore, give yourself a few minutes to figure it out. What can I do to make the patient live? So what answer choice will keep the patient alive? Which answer choice I'll do first in real life? If you are working in the hospital right now, which one do you think you would do? That's the thing. You got to bring it down. Then you say, I cannot wait 5 minutes. That's why I said 1 second. 5 minutes is even too much. 1 second. Give yourself 1 second. If I have 1 second, what would I do? And then ask yourself, can I do something right now without calling the doctor? And this is an example. Which action should the nurse take first? A nurse is caring for a post-operative client. The nurse notes restlessness, bad problem, tachycardia, bad problem, decreased oxygen saturation. I've told you, this patient is crashing. You have to analyze the question. Said, I have somebody who is dying. Do I need to rescue them or do I just need to do something? Therefore, do I give them pain medication? Is post-op, he has surgery. Is pain causing the problem? Reposition the client, right? Apply oxygen or notify the healthcare provider. If you use the BESHARP, you can see that this is like airway problem. This is like shock problem. This is like so many things. But the major problem is what? What would you do to save the patient? I don't want to apply the BESHARP. I just want to show you how to be just thinking about how you can analyze the question. The next note, restlessness, tachycardia, decreased oxygenation. Those are all bad problems. You don't need any more assessment. You got to do something to rescue the patient. If you give the patient pain medication, oxygen saturation is going to go down. Therefore, which one will save the patient life? If you give them pain medication, is a problem. If you reposition the client versus oxygen, which one will keep the patient alive? Like I told you, you're unsure, so you're going through. I think oxygen is better. Notify the healthcare provider. Hey, can the RN do something first? Oh, yes, RN can do something first. In rare situation, what would I do? I'm not going to give him pain medication. I may reposition, but I feel like it's not going to keep him alive. I would just apply oxygen. You see the way you can go through the process? Number 3 is much better. Now, this is the thing. If you've seen the 2026 test plan, this is what everybody's talking about. But look, it's already there. NCLEX been doing that in prioritization. You just put a name to it again. You've been doing it, so don't freak out. It's already there. There's two types of prioritization. There's a rescue thinking and there's a prioritization thinking, which we've done that, but I do not want to use it. I just want to wait until we get here. There is rescue thinking. Rescue means you're rescuing the patient from dying. And that means they're already in the process of dying. They have symptoms telling you their condition is worsening. They're already in the problem, like the last question we saw. Patient is in the problem, is restless, is hypotensive, is already getting it. You are not preventing them from becoming hypotensive. You're already hypotensive. That means client is unstable, immediately threatening to their airway, breathing, and circulation. The nurse must act now. Intervention. Don't do any more assessment. No waiting, no teaching, no routine assessment, nothing. So if you hear about it, rescue thinking, don't freak out. You've been doing it in prioritization question where you got to do something right away. And that's the one you see immediate, intervene, right? It's not the first one. This one are the one you do immediate intervention right away. You got to do something right away. It's different from priority thinking, where they give you multiple patients and you got to pick one of them. Is going up with them, you want to pick the one that does not go into a rescue situation where you got to do emergency. So you discuss on which one you want to do. You have time, but the time is very sensitive. If you don't do anything right now, you have to rescue the individual. That means they're going to die. And that's the difference. So what is that? These are the buzzwords you should be looking for. In rescue thinking, is my client crashing? Their airway is blocked, right? Like asthma patient with wheezing so tight, or they have stridor, right? Oxygen is dropping. You got to rescue them. They're bleeding, rescue them. They're already in shock. They're already in the problem, right? They're having anaphylactic shock. What do? You stop the poison, right? Acute change in mental status, figure out what is going on, rescue them from that situation. They're already in it. Unlike priority thinking, it's risk reduction. You're preventing. You want to know who situation is getting to the point that they will be in the rescue problem. So multiple clients, multiple tasks you got to do on that patient. The patient is at risk of worsening condition, so you got to think about it. That's the rescue thinking and normal prioritization. So these are now examples of all of them. We're going to go through them. I want you to take a break, think about it, pick an answer choice, put it in the comment section so that you know, you stop the video so that I can know that you master the content, you apply it to this situation. The questions are not tricky, they are not difficult, they are designed to teach you so that when you see those that require critical thinking, use the same process. Critical thinking means you're using process of thinking to find an answer. So don't freak out. Which action is appropriate? A nurse is caring for a client with what? Suspected increased ICP. You got to bring your content. If your ICP is high, well, something is going to happen. The word suspect tell you they have done assessment. They figure out that the ICP is high. The patient has shown some signs and symptoms of that. You don't need any more assessment. But what do you think? Increased ICP, I got to do something. If I don't do something, patient is going to go into a situation where they will need to be rescued. So this patient is not crashing, but I need to do something now to fix them. Remember, the topic is what? Opposite answers. Can you pick the two opposite answers there? One says place the client flat. The other one says elevate the head of the bed. Another one says encourage coughing. And four, provide deep suctioning. You can see that what? There's a bunch of opposite answers and the same answers, similar answers in the same question. But if you use test-taking strategy, you can figure out which one is the right answer. Which one did you pick? ICP. Therefore, I should not increase the ICP. Anything that is increasing ICP is a wrong answer. One. Number three, encourage coughing, increases ICP. providing deep suction is going to increase ICP. Both of them are saying the same thing. Therefore, they are wrong. You see, similar answers. 3 and 4 are wrong. Now you're left with 1 and 2. One said flat, one said head of the bed up. That means they are opposite. That means one of them is the right answer. If I need to decrease your ICP, I should not put you in flat. I should elevate your head. Therefore, 2 is the right answer. And this is the way you should master them. This is the way you should apply this strategy. Therefore, number 2 is the right answer. If you're struggling, I want you to go through the process. And if you do that, you'll be able to pick prioritization question easily. Next one, similar answers, right? And this is caring for a client who is post-operatively day 1 after abdominal surgery. So patient had abdominal surgery. The client report abdominal pain, right? And the nurse notes that the blood pressure is what? 88/56, and the heart rate of 124. Which action should the nurse take first? Assess the client pain, auscultate bowel sound, notify the air care provider immediately, or IV fluid. You have to bring your content once again and analyze, spend time to break down the question. Patient has surgery. Yes, I know he's going to have pain. Okay, that's what is being asked of you. And what is the being asked? Which action should you take? What are your buzzwords in the question? Hypotension and what? Tachycardia after surgery is what? Shock. This patient is in shock. If it's in shock, I got to do something. I don't need to do any more assessment. Look at the answer choice and say, hey, assess the client level of pain. Assessment? Listen to the bowel sound. Both of them doing assessment. They have to be wrong. Similar answers, eliminate them. You're left with 3 and 4. Now, can I do something now if my patient is crashing? That's what we talk about, the strategy. If the patient is crashing and I'm unsure, is there anything that can help with the patient? Hey, I can give them fluid, then I call the doctor. Therefore, 4 is the right answer. Patient is in shock, you can intervene. You better give them fluid, why then you talk to the doctor. So 4 is the right answer. Do you do assessment or intervention? The same strategy as you saw in the previous question, but we can use the same thing. And this is caring for a client, sudden shortness of breath and chest pain. We saw this question already. What should the nurse do first? They've told you, I said, what? Shortness of breath, sudden onset, chest pain. Do you think you got to assess or do something? I'd rather do something rather than assessing them. Giving them morphine is not going to help with the chest pain. It's not going to help with the situation. It's just going to address the chest pain, but that's not the problem. Obtain vitals is what? Doing more assessment. Reassuring the client is not good. This patient is dying. Rapid response. We should rescue this patient. So 3 is the right answer. The nurse is unsure which intervention is best for patient who is declining. Which action is the safest? What do I say? If you're unsure, pick the one. Ask yourself, is the patient dying and can I do something to save them? Is there anything I can do before calling the doctor? Is the patient does not have time? So what is the answer? Teach the patient life modification. Does that help a condition dying right now? Document the finding. You're doing nothing. Reassess an hour. Patient is dying now. Therefore, pick an answer that you know will save the patient life. 4 is the best answer. Stay with the patient. If you want to assess every hour, why don't you stay with the patient and come back and just stay there so that in case when you leave within 30 minutes, something happening, you've lost it. Therefore, stay with the patient. Number 4, right answer. Now, this is rescue. I've told you, you've done this multiple times, but you may hear the word and you think something new is happening. It's the same thing. Don't worry. Don't freak out. Don't let anybody tell you, hey, rescue thinking is something. You've done it. Pick an answer choice. Patient who is dying and you need to do something. They're already in that situation. Patient already have an MI and is in cardiogenic shock. Do something. That's what it means. it doesn't mean you preventing them from getting heart attack. They already have attack in cardiogenic shock. A nurse is caring for 5 clients on the med-surg ward. Which client required immediate intervention? Selected apply. Therefore, there's only 5 patients there. Therefore, which one you need to do something? Intervene right now. Look at the patient and see who is in trouble. Client with COPD, sudden oxygen saturation of 82, all of a sudden dropping, and he's using accessory muscle. What do you think? Is this patient, you have time with that patient? That's BESHARP. This is what, if you use the BESHARP, you can see this is a breathing issue. Do you have time with this patient? I don't know. It's a sudden onset of saturation. Look at the 2. Chest pain. But the chest pain is what? 3 out of 10. Remember, just because he has chest pain doesn't mean you got to jump the gun. It said 3 out of 10 who requests acetaminophen. Would you have to go see this patient? 3 out of 10. Client who has 1 day post-op and report shortness of breath with hypotension. Look at his blood pressure. Shortness of breath, hypotension. That's bad. A client with type 2 diabetes who has mild fatigue and he want to be discharged. Do you need to rescue this patient? Sudden confusion, restlessness, and his blood glucose is 42. You can see which patients are in trouble, which patient condition has changed, which patient you have to be sharp. And when you are being sharp, you're trying to rescue the patient or prevent risk reduction. Therefore, 5 is a bad problem. We got to pick 5. Otherwise, we are in trouble. 4 is okay. We don't need. This guy is in shock. Shortness of breath, hypotension. I got to pick you. 3 out of 10. And he's just asking for pain medication. It's not a problem. COPD and saturation going down using accessory muscle is problem. Those are rescue thinking that you got to bring in. And now, last one. This is prioritization, regular prioritization. You don't have to rescue them, but you got to prevent them from going to a situation where you got to rescue them. Therefore, whose condition has changed, but they are stable. They're not dying right now. They're giving a warning sign. Heart failure with sudden onset of 2 weight gain in 24 hours. That's not good. You have to bring your content when it comes to these kind of buzzwords. Type 2 diabetes, you need teaching. There's nothing acutely going on right now. Blood pressure, and he's scheduled for discharge, where he's going to go home. COPD, fatigue, oxygen saturation is 95. Still, something is telling me, it's just fatigue. Is that what I expect in COPD? Yes, when they walk or whatever. But look at his saturation. I can't do anything about it. 95 is the best I can get. Post-op nausea, who is asking for what? Antiemetic. What do you think? Something is not right. If you look at it, I was trapping you. Normal 5 is okay. It's just an antiemetic. But look at the COPD patient. I know they can get fatigue, but there's a word there, increased fatigue. That is telling me that I don't like it. I need to check on them. He's not dying, right? I need to check on him so that I can figure out why his fatigue is going up. Even his saturation is 95, it does not matter. He's having problem, priority. This guy is going to go home without any issue. Type 2 diabetes, just need teaching. And if you gain sudden onset of weight gain, you have CHF, both A and 4. If you don't do something, you may have to rescue them. And that's prioritization. Those are the ones you got to pick in this situation. SATA prioritization, selected apply prioritization. Now, in a summary, when it comes to prioritization question, how do you choose answers? Look for similar answers. Of course, you got to come up with a strategy. BESHARP is my strategy. Like I say, if you need more, check Adapt NCLEX. I have a bunch of video with a bunch of case study and questions that we can go through multiple times. You can see how to apply. 2, A, similar answers. If you look the same, let them go. If they're opposite, one of them is the right answer. If the patient is crashing, you got to intervene. If not, always make sure you do assessment. If they tell you enough information in the question, assessment is already done. And if you're unsure, hey, ask yourself, which one will keep the individual alive? And which one I can do something without calling the doctor? If you need to do rescue thinking, it means patient is already in the problem. He's dying from the problem. So do something. Don't go and listen to the lung. Example, if somebody has a chest tube and chest tube just came out from the chest and there's a hissing sound, you're not going to listen to the patient lung. The chest tube is out of his lung, his chest, and they're having airway issue. You just tape it on 3 sides and put the sterile gauze over there. That is going to save them rather than listening to them. And if you have time, that's prioritization. It's your choosing. Which order should you choose? Which one would you prioritize? You have 4 options. I got to see you in that order. It's my priority. I'm thinking who I need to act first, 1 second before I need to perform a rescue thinking strategy. This is adapting class. This is how you choose answers. For the subscriber who requested this video, thank you. You are not alone. This is how NCLEX is trying to do and make prioritization a little bit tricky, but you can answer them if you know how to approach answering questions. You can use these to answer any questions you want. And take care of yourself. Subscribe for more content like that. And good luck.